This shocking habit in the morning might be raising your risk of stroke, and most seniors never suspect it. I say that as a neurologist who has spent decades in clinics and stroke units watching patterns repeat. Small, daily routines that feel harmless can, when they meet the particular biology of the older body at dawn, tip the balance toward danger. Today I'll walk you through 7 very common morning habits, explain the physiologic reasons they matter, share short patient stories that bring this to life, and give you specific low-effort changes you can start tomorrow. If you want more simple, doctor-tested brain health tips, hit subscribe and the bell, then stay with me for the next 20 minutes. This is the sort of information families need to hear. Why the morning matters. First, a quick plain English frame. An ischemic stroke happens when a clot blocks blood flow to part of the brain. Without timely blood flow, brain cells begin to fail. That's the core risk we're trying to reduce, not by promising a cure, but by understanding moments of vulnerability and lowering the chances that those moments line up with a trigger. The first hour after waking is a unique window. Overnight, we lose fluid through breathing and sweat. Blood becomes a little thicker. Blood vessels, especially in older adults, are stiffer and react differently than they did decades earlier. At the same time, the body jacks up adrenaline and cortisol at dawn, hormones that raise blood pressure and make blood more likely to clot. Put those 3 together: dehydration, vessel stiffness, and a hormonal surge, and the morning becomes a period of heightened risk. Now add routine behaviors, a quick jolt of caffeine, a rush to the bathroom, or simply sitting motionless. And these small acts can push that fragile balance the wrong way. I'll use simple metaphors because they stick. Think of your blood like syrup instead of water when you wake up. Thicker, slower, more likely to stick. Think of the valves in your leg veins as one-way doors that get stiff with age. When they don't work as well, blood pools. Think of the morning hormone spike like a gust of wind that can jerk pressure up suddenly. When combined, these forces can increase the chance that a clot forms or that a pressure surge causes a vessel problem in the brain. Habit 1. Coffee or caffeine first thing before you hydrate. What it looks like. You open your eyes, shuffle to the kettle or coffee pot, and drink your usual cup immediately. On the way to the bathroom while checking the phone or standing by the sink. Why it matters physiologically. Caffeine has a rapid effect on the cardiovascular system. It raises heart rate and blood pressure temporarily and can constrict cerebral blood vessels. In an already dehydrated person with morning blood that's a bit thicker, that extra pressure and constriction creates a small but meaningful increase in the chance that a clot-forming process starts or that blood flow becomes uneven. In older adults, the rise in blood pressure can be larger and last longer than in younger people, and stiffer arteries amplify the pressure surge. Patient vignette. I once saw an 82-year-old man who lived alone in Arizona. He'd always started every day with a large, strong cup of coffee before doing anything else. One morning he felt dizzy, his speech slurred for a few minutes, then recovered. Imaging showed tiny new changes in his brain, consistent with several small ischemic events. When we reviewed his routine, that immediate coffee was a clear, repeated stressor on a morning already primed for trouble. He kept his love of coffee, but we tested a different routine. What to do instead? Hydrate first. Keep a glass of water by the bed and drink a full glass as part of your wake-up ritual. Wait 20-30 minutes before that first strong cup. The water helps thin the syrup, improves blood volume, and reduces the magnitude of both blood thickening and the pressure spike. If you're on medications that interact with food or water, check with your physician before changing timing. Don't stop or shift prescriptions without medical advice. For the majority of people, the simple rule is water first, caffeine a bit later. Habit 2. Sitting on the edge of the bed for a long time before standing. What it looks like. You wake, swing your legs over the side of the bed, and sit there while you plan the day, check messages or steady yourself, sometimes for several minutes. Why it matters physiologically. When you sit with your legs dangling, gravity pulls blood into the lower limbs. In younger bodies, muscle tone and venous valves push that blood back when you stand. In older adults, the pumping action and valve function are often less reliable. Prolonged sitting on the bed edge allows blood to pool. That venous stasis raises the risk that microscopic clumps begin to form, especially in the presence of thicker morning blood. Then, if you stand abruptly, the sudden change in blood flow and pressure can cause dizziness and an unstable environment in which a clot, if present, has a greater chance of dislodging and traveling. Patient vignette. A 79-year-old retired teacher from Ohio described a pattern. He'd sit on the bed edge for coffee, then stand and feel a wave of lightheadedness. Once he nearly fainted while reaching for a cane. He had a history of high blood pressure and hadn't realized that sitting still was part of the problem. With a few simple steps, his dizziness declined significantly. What to do instead? Engage the pump. Before you stand, do 1 to 2 minutes of ankle pumps and toe raises right where you sit. Lift your heels, point your toes, and gently flex the ankles. Plant your feet, push through them, and stand deliberately rather than springing up. If balance is an issue, use a bedside chair or grab a stable surface to steady yourself. Those extra minute long movements activate calf muscles, reduce pooling, and improve venous return. Over time, that small routine decreases the chance that blood will sit too long in the legs, where clots can start. Habit 3. Rushing to the bathroom and straining what it looks like. You dash for the bathroom first thing, sometimes pushing or straining, especially if you're constipated or have a weak bladder. You might hold your breath and push hard, or you may stand quickly and strain to void. Why it matters physiologically. Straining and the Valsalva maneuver increases pressure in the chest and abdomen and briefly alters blood return to the heart. This sudden hemodynamic change can provoke sharp blood pressure fluctuations. In the morning, when vessels are stiffer and blood is thicker, those swings are riskier. Straining can also dislodge small clots from the peripheral circulation or encourage transient changes in blood flow that create shear forces inside vessels. In short, straining amplifies the morning's already unstable physiology. Patient vignette. A 76-year-old woman from Michigan described waking with a sense of pressure and rushing through her morning, often feeling palpitations after straining at the toilet. She once experienced a transient weakness in an arm that resolved, but which her family noticed. A focused approach to bowel and bladder health, gentle regimens to prevent straining, and a slower, deliberate bathroom routine reduced her symptoms and gave her a safer morning pattern. What to do instead? Slow the start. Protect the flow. If constipation is a problem, work with your clinician on long-term gentle measures, fiber, hydration, and a scheduled bathroom time that avoids rushing. When you need to void, take your time. Breathe out slowly rather than holding breath and pushing. If you have a history of urinary retention or prostate issues, speak with your doctor about strategies that avoid forceful straining. Small structural changes, a raised toilet seat, a bedside commode for those with mobility problems, can prevent hazardous rushing. Mid-video engagement. If this is helping, type 1 in the comments. It tells me this is useful and that I should make more episodes like this. Habit 4. Skipping breakfast or taking important medications on an empty stomach. What it looks like: you skip breakfast to save time, or you swallow blood pressure or diabetes medications before eating because you always have, sometimes out of habit, sometimes because the pill bottle says, take on an empty stomach. Why it matters physiologically. Food and water intake after a night of fasting restore blood volume and provide glucose the brain uses. Skipping calories or water keeps blood relatively concentrated. Some medications work differently depending on whether the stomach is full. In some cases, taking certain drugs without food can cause larger, quicker effects on blood pressure or interact with the morning hormonal surge in ways that increase instability. Conversely, taking medications that lower blood pressure right before you stand up and move can, especially if you're dehydrated, lead to a drop in cerebral perfusion, reduced blood flow to the brain. That drop may produce dizziness, falls, or transient ischemic symptoms. Because drug interactions are individual, this is an area where a tailored conversation with your doctor matters. Patient vignette. A 72-year-old man from Florida had started his day with a handful of pills before breakfast for years. He described several mornings when he felt foggy and weak, especially after standing. When we reviewed his medication schedule with his primary care physician and adjusted timing so that a small snack came before certain agents, his morning fog lifted and the team felt more comfortable that his cerebral perfusion remained steadier. What to do instead? If you can, have a small bite and a glass of water before taking morning medications that might affect blood pressure or blood sugar, but only after you confirm with your clinician that this is safe for your particular drugs. If your medication explicitly requires an empty stomach, ask if there's an alternative dosing schedule that keeps you safer in the morning. Never stop or change medications on your own. For many people, a small, consistent breakfast, a piece of fruit, a handful of nuts, a yogurt, plus water helps stabilize blood sugar and reduces the morning concentration of the blood. Bringing these habits together, you can already see a pattern. 3 different routines: immediate caffeine, prolonged sitting on the bed edge, and hasty bathroom strain. Each interact with the same underlying morning physiology. They either thicken the blood, pool it in the legs, or spike pressure unpredictably. Habit 4, the timing of food and medication, can further tilt the scales by influencing blood volume and how drugs act. These are not abstract forces. I meet patients whose lives shift after we identify and change one small part of the morning ritual. Often, the most powerful interventions are low cost and low effort. Water, a minute of movement, slower transitions, and a tiny snack when appropriate. But because these habits are so ingrained, change is rarely instantaneous. It's gradual, practical, and best done one step at a time. Habit 5. Starting your day with stress, the news, social media, or a harried rush. What it looks like: the alarm goes off, and before you breathe, you're scrolling headlines, checking messages, or jumping into an immediate list of tasks. Your heart races and your mood becomes anxious within minutes. Why it matters physiologically. Stress triggers cortisol and adrenaline. In the morning, those hormones are already on the rise. Adding an emotional spike, anger, anxiety, or acute stress compounds the physiologic surge, producing higher blood pressure and greater platelet activation, the cells that help blood clot. Repeated, daily spikes can make the morning window riskier, especially in older adults with stiff arteries or other risk factors. Patient vignette. A 72-year-old veteran from Texas used to begin the day flipping through 100 headlines and several phone alerts. He described a sensation of his heart pounding every morning. After intentionally delaying his news intake for 15 minutes and spending 5 minutes on deep breathing, his morning heart rate and subjective anxiety fell, and he felt steadier during the day. What to do instead? Create a calming buffer. Keep a list of low-effort calming rituals. Light breathing for 2 to 5 minutes, listening to a gentle song, or reading something uplifting before tackling news or email. Consider a no news for 10-15 minutes rule as part of the first-hour routine. For many older adults, this alone reduces the morning hormonal surge enough to make other small fixes more effective. Habit 6. Ignoring morning blood pressure checks. What it looks like: you don't monitor blood pressure at home, or you only check it in the clinic later in the day. You assume your pressures at the office represent your daily pattern. Why it matters physiologically. Blood pressure is not constant. It fluctuates, and the morning surge is a known phenomenon. Some people have higher pressures in the morning than at other times. Those morning spikes are linked with higher risk of cardiovascular events, including ischemic strokes. Without measuring at home, you miss that critical piece of information that could change management and timing of medications. Patient vignette. A 78-year-old man from Virginia had normal clinic readings, but experienced mini spells of dizziness each morning. When we had him check his blood pressure at home, his numbers were significantly higher within the first hour of waking. That allowed his care team to adjust timing and strategy safely, improving control and reducing morning instability. What to do instead? If you can, measure your blood pressure at home in the morning, about 30-60 minutes after waking and before taking medications if your clinician recommends that approach. Record readings for a week and share them with your doctor. A simple home monitor and a short log can reveal patterns that a single clinic measurement misses. Again, don't change medications on your own. Use the data to have an informed conversation with your clinician. Habit 7. Sitting still for the first hour after waking, reading, watching TV, or not moving much what it looks like. After rising, you sit in a chair or on the couch for 30 to 60 minutes doing little. Perhaps watching television, reading, or talking on the phone. Movement is minimal. Why it matters physiologically. Prolonged inactivity allows blood to remain sluggish. The calf muscle pump, the primary driver of venous return from the legs, needs movement to push blood upward. Inactivity encourages pooling and venous stasis, which in turn increases the likelihood of clot formation. The first hour is critical. Keeping blood flowing during that time minimizes one of the 3 big risks. Patient vignette. A 74-year-old retired engineer in Colorado enjoyed his quiet hour in an armchair each morning. He began experiencing intermittent leg swelling and once had a brief episode of facial droop that resolved. Introducing 2 to 5 minutes of light walking in place and a few standing stretches each morning decreased his swelling and reduced the odd episodes. What to do instead? Move a little. Aim for light activity in the first hour, gentle walking in place, marching 1 foot at a time, or a short stroll down the hallway. If mobility is limited, do seated leg raises, ankle circles, and gentle calf squeezes. Even small increments of movement keep blood moving and reduce pooling. Over days and weeks, those minutes compound into meaningful risk reduction. A common thread and a caution. Across these 7 habits, the same underlying theme appears again and again. The morning is a fragile window. Thicker blood, stiffer vessels, and a hormonal push at dawn create conditions where pressure spikes, venous stasis, or sudden shifts in flow are more consequential than they are later in the day. Changing 1 or 2 small parts of your routine. Hydrate first. Move a little before standing. Delay strong caffeine. Avoid straining. Eat a small snack before certain meds. Calm the first minutes and measure home blood pressure can nudge that window back towards safety. But a word of caution. This is not a guarantee. Stroke risk is multifactorial, and habits interact with age, genetics, chronic disease and medications. I won't promise that changing these steps will remove risk entirely. What I will say from years of clinical work is that incremental, consistent changes in the first hour after waking often produce outsized benefits. Before we continue to the practical, consolidated checklist and the small, stepwise plan I recommend for families and caregivers, there are a few questions I want to address that come up every day in the clinic. First, how soon will you see improvement? Second, what if mobility or cognitive limitations make these changes hard? And third, what do you do about medication timing? Let's tackle those next. First, how soon will you see improvement? The short answer is, often faster than people expect, but it depends on the change and on individual health. Physiology moves on two clocks. Some effects are immediate. Drink a glass of water, and within 20 to 30 minutes your blood volume rises a bit, your heart doesn't have to work as hard to push that thicker syrup, and you'll often feel steadier when you stand. Do the ankle pumps or 2 minutes of calf activation, and the next time you stand, you'll notice less lightheadedness. Those are quick wins, small shifts in flow that almost everyone can feel within days. Other improvements take weeks to show reliably, regularly avoiding heavy, stressful morning triggers and slowly building light movement into the first hour changes patterns of clotting tendency and blood pressure variability over time. Platelet activation and the tendency for blood to clot aren't flipped on and off by a single action, but they do respond to consistent, repeated behavior. Over a month or two, caregivers and patients commonly report fewer morning spells of dizziness, less swelling in the legs, and a stronger sense of balance. Let me give you an example. One of my patients, the retired teacher from Ohio, started ankle pumps and moved his morning pill time slightly as agreed with his primary doctor. Within a week, he felt steadier getting up. Within a month, his spouse reported he no longer needed to pause for breath after standing. Another patient, the man from Florida, who adjusted his medication timing after a small breakfast, said his morning fog lifted within a few days, and the team felt better about his fall risk. Those are typical trajectories: immediate subjective relief for flow-related symptoms and gradual reduction in measurable risk factors like morning blood pressure spikes or persistent pooling. What if mobility or cognitive limitations make these changes hard? This is a key question because many older adults live with joint pain, Parkinsonism, arthritis, neuropathy, memory loss, or reduced endurance. The first rule is adapt, don't abandon. Small, achievable steps matter more than big, perfect routines. If standing or walking is difficult, focus on in-place or seated strategies. Ankle pumps, heel raises, and seated marching, lifting knees alternately while seated. Engage the calf pump and improve venous return. Use the arm muscles too. Seated arm circles and gentle shoulder rolls increase circulation and reduce morning stiffness. If hands are weak, simply squeezing a softball or a rolled towel several times is movement that helps. For those with balance concerns, use supports. A bedside chair to sit on for a brief ankle pump session, a sturdy bedside rail, or a walker positioned within reach can make the transition safer. For people with significant gait instability, the presence of a caregiver or the use of a bedside commode for the first bathroom trip may be the safest choice. These are practical options, not dramatic medical interventions, that prevent hurried movements and reduce the need for straining or sudden standing. If cognition is the barrier, forgetting steps or getting distracted by the phone, create simple cues and structure. Keep a large print checklist by the bed. 1. Drink water. 2. Ankle pumps 60 seconds. 3. Stand slowly. Use visual timers or an automatic kettle that beeps when water is poured. Place a glass of water on a coaster with a bright sticker that signals "Drink first." Caregivers can help by setting this up and gently prompting the routine until it becomes habitual. When caregivers are involved, the best practices are low friction and dignified. Rather than watching every step, set up the environment so the safer behavior is the easier behavior. Keep water within reach. Use non-slip mats and a raised toilet seat. Keep a light on a timer so the bedroom and bathroom are well lit at first movement. These small supports preserve independence while lowering risk. Medication timing. The question everyone asks: can I change when I take my pills? This is where individualized medical advice is essential. Medications vary widely. Some are best taken on an empty stomach, others with food. Some drugs lower blood pressure more strongly early in their dosing cycle and could increase the chance of a morning drop in cerebral perfusion if you stand too soon and are dehydrated. What I recommend as a clinician is a simple, data-driven conversation with your prescriber. Start by doing a short experiment with the doctor's guidance rather than a blind switch. For example, measure your blood pressure at home for a week, both in the morning before medication and 30-60 minutes after medication or after a small snack, depending on instructions from your clinician. Record these values and bring them to the appointment. That data tells a prescriber if a timing change is reasonable or if an alternate strategy is safer. If a medication physically must be taken on an empty stomach, do not change that instruction on your own. Ask whether the pill can be taken at a slightly different time. Bedtime dosing is a common adjustment for certain agents, or whether another formulation exists. Work with the team to balance the risks. An office team can choose to adjust timing, change medication class, or add a small food buffer when safe. Never stop or adjust doses without medical supervision. The safest path is always the path taken with your prescriber and informed by home measurements. Let's be practical now. I want to give you a clear, step-by-step beginner plan you can try this week. It's designed to be low effort and scalable. Start with one item and stack another as it becomes routine. A 7-day starter plan. Day 1, the water rule. Place a full glass of water by the bed tonight. When you wake, drink the glass before getting up. Notice how standing feels. Write down any dizziness or ease of movement. If you're on morning meds that must be taken empty, note that in your log and bring it to your provider. Day 2, add 2 minutes of movement. After the water, while still sitting, do 90-120 seconds of ankle pumps, heel raises, or seated marching. Stand slowly and notice the difference. If balance is a concern, hold a chair or bed rail. Day 3, delay the first coffee. Keep your usual coffee, but set a reminder for 20-30 minutes after waking. Use that delay for hydration and the short movement session. See if your morning jitter or heart racing is less intense. Day 4, gentle breakfast bite. If you've been skipping breakfast or taking meds on an empty stomach, introduce a small, safe snack, a banana, a yogurt, or a handful of nuts, after checking with your doctor about whether that's okay with your medications. Pair it with your water. Day 5. Calm the first 10. For at least the first 10 minutes after waking, avoid news and social media. Instead, practice 2 to 5 minutes of slow breathing. In for 4 counts, out for 5. Use this time to focus on the next small step in your routine. Day 6. Measure and log. Acquire a simple home blood pressure cuff if you don't have one. Take a morning reading 30 to 60 minutes after waking and before medications if your clinician agrees. Record the last 2 digits of your systolic reading and whether you felt dizzy. Share this log with your clinician if something looks off. Day 7. Light movement goal. Aim for 2 to 5 minutes of light walking in place or a short hallway stroll within the first hour. If mobility is limited, repeat the seated movement several times. Reflect on what changed this week and pick 2 habits to continue. This plan is intentionally modest. Its power comes from repetition. Do a small thing every day rather than overwhelm yourself with a perfect routine. Practical tips for caregivers and family members. Caregivers play a crucial role in making morning routines safe and sustainable. Your task is not to micromanage, but to design the environment for success. Create habit anchors. Anchor a new behavior to an existing one. After I turn off the alarm, I drink water. Use visible cues. A colored coaster, a sticky note on the bedside table, a timer that plays a gentle chime after 20 minutes to signal coffee time. Simplify medication management. Use a pill organizer and a large print schedule that lists which pills need food and which need emptiness. Put the pill organizer next to the snack bowl or water glass so the sequence becomes obvious. Make the first movement safe. Install grab bars in the bathroom. Use a bedside lamp on a timer. Consider a bedside commode for those with nighttime toileting needs. Make floors non-slip and remove trip hazards. Teach slow standing. Encourage rising in phases. Sit. Do ankle pumps. Swing legs. Stand by, pushing through both feet. Pause, then walk. If the person is unsteady, escort them the first few times until the pattern is solid. Monitor and report. Keep a simple log of morning dizziness, falls, or new facial droop, slurred speech, or arm weakness. These notes are invaluable when a clinician needs to decide whether more evaluation is required, when to be concerned and call for help. It's critical to know the difference between routine morning unsteadiness and signs of a stroke. If you or a loved one experiences sudden onset of any of the following, treat it as a medical emergency and call emergency services immediately. Sudden weakness or numbness in the face, arm or leg, especially on one side of the body. Sudden confusion, trouble speaking or difficulty understanding speech. Sudden trouble seeing in one or both eyes. Sudden trouble walking, dizziness, loss of balance or lack of coordination. Sudden severe headache with no known cause. We use the fast memory aid in clinic. Face droop, arm weakness, speech difficulty, time to call. Don't hesitate. Time matters for stroke treatments to be effective. Also, call your clinician sooner rather than later if morning blood pressure readings are consistently high in the first hour. If you have repeated transient neurological symptoms, brief slurred speech, brief arm weakness, transient visual disturbances, or if ankle swelling and leg pain suggest possible deep vein thrombosis. These are the kinds of patterns that benefit from timely medical evaluation. Addressing common medical contributors, AF, sleep apnea, and chronic dehydration. There are conditions that raise baseline risk and make morning vulnerabilities more consequential. Two common ones are atrial fibrillation, AF, and obstructive sleep apnea, OSA. Atrial fibrillation is an irregular heart rhythm where the upper chambers of the heart beat chaotically. That rhythm can allow clots to form in the heart and travel to the brain, causing ischemic strokes. AF can be intermittent and subtle, sometimes felt only as palpitations or a racing heart in the morning. If you notice irregular, pounding or fluttering beats, bring that up with your clinician. Often a simple pulse check or a brief ambulatory monitor can detect AF, and treatment options exist that significantly reduce stroke risk. Obstructive sleep apnea, pauses in breathing during sleep, causes repeated oxygen drops and surges in blood pressure overnight and in the morning. It's associated with higher stroke risk and amplified morning blood pressure spikes. Symptoms include loud snoring, witnessed pauses, daytime sleepiness, and morning headaches. If this is likely, ask about a sleep study. Treatment with a CPAP machine can improve overnight oxygenation and reduce morning hypertension in many patients. Chronic dehydration is surprisingly common in older adults. Diminished thirst sensation, diuretic medications, and mobility limitations reduce fluid intake. Encourage regular fluid intake throughout the day and make water easily accessible. For many older adults, a goal of consistent, modest hydration is safer than large volumes at once. Low-tech monitoring and when to escalate. You don't need high-end equipment to detect worrying trends. A basic home blood pressure cuff, a simple 7 to 14-day log, and careful attention to new morning symptoms are enough to decide when to seek more help. If morning pressures are consistently elevated compared to clinic readings, or if symptoms persist despite simple behavioral changes, ask for a daytime ambulatory blood pressure monitor or a medication review. If there are repeated transient neurological events, brief slurred speech, brief one-sided weakness, brief loss of vision, these are transient ischemic attacks until proven otherwise and warrant urgent evaluation. They are warning signs that the brain is being stressed and that a definitive plan is required. Practical examples of low-cost adaptations. Here are simple, affordable items that make the routine safer. A sturdy bedside table to hold water, a wide-mouthed cup with a straw for easier drinking, a soft rubber stress ball for hand exercises, a non-skid mat beside the bed, a bright clip-on lamp on a timer, an inexpensive wrist blood pressure monitor, and a gel seat cushion for comfort during seated movement routines. None of these are expensive. All reduce friction and increase the likelihood of a sustained change. Dealing with travel, holidays, and disruptions. We live in an irregular world. Travel and holidays can disrupt routines and increase risk because sleep patterns, medication timing, and hydration can change. When traveling, plan ahead. Bring a small water bottle you can refill. Set a simple morning routine reminder, and if time zones shift dosing schedules, discuss temporary adjustments with a clinician before you leave. For short disruptions, focus on hydration and steady movement on waking. These two behaviors carry the most immediate protective effect. Putting it all together, a concise morning checklist. This short checklist is what I ask patients and families to keep in mind. It contains the most consistent, evidence-aligned, low-effort actions that reduce morning vulnerability. 1. Hydrate first, a full glass of water on waking. 2. Move a little, 1 to 2 minutes of ankle pumps or 2 to 5 minutes of gentle walking within the first hour. 3. Delay strong caffeine, wait 20-30 minutes after drinking water. 4. Avoid straining. Create bowel and bladder strategies to prevent forceful bearing down. 5. Take a small snack before certain medications when clinically safe. Check with your clinician. 6. Measure morning blood pressure and record trends. Share them with your care team. These 6 steps are the core, first-hour medicine I prescribe informally to many patients. They're simple, they're cheap. They stack into a routine that, over weeks and months, reduces the cumulative exposures that raise stroke risk. A final, practical encouragement: change is hard, especially when habits have been steady for decades. Start with one modest action. Hydrate for 3 days straight. Notice how you feel. Then add a brief movement. Build slowly. Use family and caregivers to support the environmental changes that make the safer choice the easier choice. Be kind to yourself. This is not about blaming the past. It's about giving your brain a better set of chances. The first hour of the day is a potent window. Protecting it is not glamorous, but it's effective. It's the kind of preventive medicine that fits into the cup holder, the bedside table, and the small minutes of a family morning. Before I close, a few final reminders. If you notice sudden neurological symptoms, facial droop, one-sided weakness, slurred speech, sudden vision loss, call emergency services immediately. If you're considering changing medication timing, bring your home blood pressure log to a clinician and discuss options. And if you have symptoms suggesting atrial fibrillation or sleep apnea, ask for evaluation. Treating those conditions is a major stroke risk reduction strategy. If this is resonating, please leave a comment describing one morning habit you'll try to change. Like and share this video so others who care for older adults can protect the first hour of their day. Subscribe if you want more doctor-tested practical steps to keep your brain and heart healthy. Talk with your clinician about your personal risks and the best timing for medications in your situation. Small, consistent actions matter. Protecting the first hour after waking is one of the simplest, most powerful ways to give your brain a better chance. Thank you for caring enough to learn and for taking the first step toward a safer morning tomorrow.